This is BayRadio.
I'm Jeremy Kenton. Researchers at the University College of London have found a link between gum disease and high blood pressure. Now, the normal blood pressure range is measured with what's known as the systolic and the diastolic of normally around 120/80, so that's measured in millimeters of mercury. And they found that 14% of people with periodontitis had a medically high blood pressure, in other words, over 140 on the systolic. The figure is slashed in half for people with good oral health, but the study showed that the gum disease gave a higher risk factor of high blood pressure. And one has to remember that periodontitis is an infection that often leads to bleeding and can result in bone loss in the jaw and also tooth loss. And the habits of contact lens wearers were analysed by researchers from the UK. And they found that the risk of infection with the frequency of showering increased. This can often lead to microbial keratitis, which is an infection of the eye causing a painful redness. And if left untreated, it can cause damage to the surface of the cornea, causing blurred vision and corneal scarring. And they found that those who showered with contact lenses in were more likely to have it. And also they found that wearing contact lenses while sleeping increased that risk of the infection. And it's estimated that over 4 million people in the UK alone wear contact lenses, and that associated eye infections are common. And a new study indicates that using air hand dryers to dry your hands may actually spread germs more than paper towels. Previous studies have also found that the hand dryers can blow bacteria from the bathroom air back onto your hands. And experts say that proper hand washing is still the most important action we can take to prevent transmitting COVID-19, because the soap has an effect on the outer layer of the COVID-19 virus. Now, what the researchers did was that they treated hands, either barehanded people or wearing protective gloves, with a harmless virus, and then asked the participants to dry their hands either using paper towels or the air dryers. They then detected the amount of virus that was transferred to various surfaces around the hospital. And when the researchers compared the two drying methods, they found that people who dried their hands using the air dryer had spread more of the virus than those who used disposable paper hand towels. So the advice is paper hand towels.